My name is Dr Al-Niaimi. I'm a consultant dermatologist with passion for cosmetic dermatology. Fillers are increasingly popular. However, it is important to understand the different types of fillers and also where to inject. An incisive facial analysis is important. The face can be divided into different zones, and the aging and the volume loss in each compartment differs from person to person. Therefore, the facial analysis, we're going to have to take into consideration the degree of volume loss, the degree of bone retrusion in some areas, and what the patient or the client expects from the treatments. Then afterwards, a thorough understanding of the different types of fillers is important, because certain fillers will be injected in certain areas. There will be a difference, for example, if you just want vectoring or lifting, for example, laterally in the cheek, or you want volumization in an area of very thin skin where you need to choose the right products. Therefore, it is important that if you would want to have dermal fillers injected in your face, that you seek someone who has an understanding of facial analysis and the different types of products, and to explain to you what would benefit you in terms of the treatment. A common example will going to be a lady in her late 20s or early 30s, where her main concern will be the so-called tired look under the eyes, and she may use the term that is commonly used, tear trough. Well, essentially, in the majority of the cases, that relates to the shadow that one would have under the eye, and it's the migration, the downward migration of the junction or the border between the thin eyelid skin and the thick cheek skin. And essentially it is a combination of some volume loss here, but it's important to assess the degree of volume loss in the cheek as well. So in that particular case, adequate volumization and enhancement of the cheek is required prior to injecting in the tear trough. For the tear trough area needs to be injected by an experienced practitioner, given the delicacy of the area and the potential for complications, and some important blood vessels and nerves run in that area. Typically I would combine, depending on the type of the patients, the use of needles, but more importantly in certain areas the use of cannulas too.